Welcome back to another episode of Veteran Oversight Now, an official podcast of the VA Office of Inspector General. I'm your host, Fred Baker. Each month on this podcast, we'll bring you highlights of the OIG's recent oversight activities and interview key stakeholders in the office's critical work for veterans. This is a special hotline edition of Veteran Oversight Now, and joining us today is Trina Rollins. Trina is the Director for Hotline Coordination within the VA OIG's Office of Healthcare Inspections. Trina is a board-certified physician assistant who worked at the VA North Texas healthcare system for 8 years prior to joining the VA OIG in 2011. Welcome, Trina.
Hi, Fred. Thanks for having me back.
Oh, happy that you're here. Today we're here to discuss the report, Discontinued Consults Led to Patient Care Delays at the Oklahoma City VA Medical Center. Before we start, as we typically do, give us some context on the size and the capabilities of this facility.
Sure. The Oklahoma City VA Medical Center is located in Oklahoma City, Oklahoma. It's a level 1B, which is a high complexity facility and is part of VISN 19, the Rocky Mountain Network. The facility operates 16 outpatient clinics and provides primary and specialty care, including surgery and behavioral health or mental health.
Great, thanks. And how did this hotline come to us and what were the allegations?
Sure. So we received the allegation that the Associate Chief of Staff of Behavioral Health Service, which we're calling the program manager in this report, was not following the consult management process and was discontinuing these behavioral health consults, which then resulted in the patients not getting needed and recommended behavioral health services. The complainant actually provided us a list of 32 patients that they felt were impacted by these, by the discontinuation, and we reviewed it, and we were able to substantiate some of those, and so we felt it was we needed to open the hotline to investigate further.
So briefly just explain what these consults are.
So a consult is an electronic request for specific services for a patient. In this case, these were behavioral health consults. So they were seen by a behavioral health provider, and it was a service that the provider felt the patient needed. And number one, the facility may or may not have had the capabilities of providing that service, or number two, that service wasn't provided at the facility, so they needed to go into the community to get the service.
So these were VA providers recommending care or trying to schedule care outside in the community.
Correct.
Right. And the other thing that struck me on this one was the relatively low number of patients this impacted. VHA deals with thousands of patients daily. These allegations only included 32. The allegations included 32. Why was that a significant enough number for us to take on this project?
So I'll answer that in that the allegation involved the program manager, behavioral health leadership, the associate chief of the behavioral health service, who was denying behavioral health services for these veterans, or, that was the original allegation. When we looked at the 32 patients, 29 of those patients had their behavioral health consult discontinued. So number one, that delays their care. 7 of those patients had a significant delay in their care. These numbers led us to believe that the problem could be much worse. When you give a sample of 32 and we found an issue with 29 of them, that's pretty significant. So we needed to ensure that the facility was able to review this concern thoroughly.
And those seven who had that significant delay, right? What did that look like time-wise?
Time-wise, it was upwards, over 6 months, some of them were delayed.
So they could have been in for lack of a medical term, they could have been in a very bad spot and not receive care for 6 months.
They were in a very bad spot, yeah. But I mean, I will give kudos to the actual mental health providers at the facility, because they continue to keep track of these patients. When the program manager was discontinuing consults, those providers were turning around and resubmitting that consult almost immediately to ensure that the program manager would get an understanding that these patients needed the care. That care was not available at the facility or not available timely at the facility. So they continued to monitor those patients, and we can say confidently, because of those delays, those 7 patients did not experience any significant harm.
Sure. So as opposed to some of our reports that focus around very tragic events, this was more focused on the greater implications.
Yeah, that's a really great way of putting it. Yeah, because this could have been very tragic.
Yeah. So describe for context what the consult management process is.
Okay, so VA has several consult designations. The consult can be in a pending status, and that means that it's been submitted to a service, but the service hasn't had a chance to review it yet. Active means the service has reviewed it and are taking steps to move to the next step of scheduling or determining if they have the availability or if it needs to go out into the community. Scheduled is obvious. They've scheduled an appointment. Complete means the appointment has happened and they've got the medical records, and they close out the consult saying that care was provided. Discontinued and canceled are the last 2 designations, and they're kind of self-explanatory. But what these designations do is they help to indicate to the provider who placed the consult what's the progress of it. Has there been timely scheduling? And once the consult is closed, it signifies that this service has been provided and there's medical records available for that provider to review. In 2021, VHA issued some updates to these designations, and they require the discontinued action to no longer be used. And the reason behind that is when you discontinue a consult, there's no way to reopen that consult or do any further care on that consult. So if they get additional information, you can't submit it into that consult and reactivate it and schedule the patient. You have to put in a brand new consult, which again is taking time, more work, more steps. But if you use the cancel designation, you can reopen the consult after you have some additional information, and you don't need to resubmit that, submit more paperwork or, electronic paperwork, but it won't delay.
Right. That's what I said. More steps inevitably lead to greater delay.
Correct.
Do we have criteria on what VHA expects with respect to scheduling community care consults?
Yes, VHA does. So when a consult is submitted to a service, they have 2 business days to change the status of that consult from pending to active. So meaning they have, about 2 business days to review it. The pending or active status then is changed to either scheduled, forwarded, completed, or canceled, and that should occur within 3 business days. So again, if they're in the midst of scheduling, that doesn't mean that the patient has already completed the appointment, but rather that the appointment has been scheduled. So the appointment could be 3 weeks down the road, but it's scheduled for April 28th, 2024.
Right.
So they have 3 days to do that. For community care consults, there's an additional step in there. So remember, if these services weren't available at the facility, they should have been recommended for community care. If that occurs, then a clinical review needs to happen. So again, within that 2 business day time frame, that clinical review should be taking place. In this case, the program manager was doing that actual clinical care review, that clinical service level review for these consults, which were recommended for community care. So the scheduler had already looked at the availability within the facility, saw that there was no availability, contacted the patient and asked them whether or not they would be amenable to going into the community, and these patients had opted in, meaning they said yes, they would want to go to the community to get the care. And then the program manager came behind and pretty much wiped out all of that work by discontinuing those consults.
So that was going to be my point. So we both in the allegation and what we found was basically that the program manager lacked a working knowledge of this consult management and scheduling processes.
Exactly.
What did they not understand and why? And explain a little bit more about what they were doing that actually delayed the action, the care.
Sure. Yeah, there were several issues. So the program manager was using an appointment availability tool to check for available appointments in the facility. The problem is that tool was still under development, meaning it wasn't operational. So the information in the tool was not reliable or accurate. So, as they looked for appointments, there were appointments there.
When you say they looked for appointments and there were appointments there, they appeared there, but they were not actually there.
Yeah, they weren't. They were using a tool that was not up to date. It wasn't fully operational. So there was availability within the tool, but none of that information was accurate. The program manager was using the appointment availability tool to schedule patients for appointments at the facility when a behavioral health scheduler had already confirmed there was no appointments available and had taken the time to contact the patient and ensure their approval to go into community care. So, the behavioral health schedulers know the clinic availability. This is what they do day in and day out. They schedule appointments for patients, and they know if there's nothing available within a 30-day time frame, that automatically makes a patient eligible for community care. So then they'll take the extra step to contact the patient and say, there's no availability here at the facility within 30 days. Would you be amenable to going out into the community? And the patient will either says yes or no. If they say no, then the scheduler will schedule them, as soon as available within the facility. If they say yes, then it moves to the next step of community care. The other thing the program manager was doing was when she saw an open slot in this appointment availability tool, she would then instruct the scheduler by putting a comment in the consult to book that specific appointment for that specific day and time for the patient without consultation with the patient. This is another prohibited practice. It's called blind scheduling. VHA mandates that patients should be consulted with appointment available dates and times and be allowed to choose when they want to schedule their appointment because, they could have something else scheduled or, their kids could have appointments at times that could conflict. So they should have some choice in that matter. And so when we reviewed the 32 consults, we saw that 29 of them were discontinued. And to us, that meant that the behavioral health staff couldn't take any further actions to ensure the patient received the care they needed. And this prevented scheduling of those appointments. So you can see that it just kind of built one on top of another.
Sure. And when we questioned this program manager on their use of the scheduling, or with the respect to the knowledge about the process, we received conflicting information from them, correct?
Yes, exactly. The program manager initially reported receiving no training, but we were able to look back at their training records and see that the required trainings on how to execute consults was completed. But then later on, the program manager reported that they didn't understand how to complete the consults. They didn't understand the difference between the cancel action and the discontinue action. But, upon further questioning, the program manager also didn't seek any clarification to try and figure out what the difference was.
Wasn't there an internal review process that should have caught these mistakes?
Actually, that's exactly what happened. The internal process is what caught the error. Yes, it was reported to OIG, but on a facility level, it actually occurred at about the same time. A staff person can submit concerns about patient safety issues through a system called the Joint Patient Safety Reporting System. Someone actually did report it, placed a JPSR, and then that report goes to patient safety, the Department of Patient Safety within the facility, who then review those concerns. When this was submitted, the patient safety officer or patient safety office then reported it directly to the facility director. That's when a review with the facility compliance officer was initiated. And then once they determined, yes, there was a prohibited practice confirmed, the facility then opened up an administrative investigation board to review it even further.
And this was roughly in the same time frame that we initiated our hotline?
It was. They had already started the review, so that when we actually engaged with them and got on site, a good majority of this had already taken place, and they were able to tell us the results of that.
And the patients, they were able to get them scheduled appropriately.
Yes, thankfully, yes. As I said earlier, the providers at the facility were very diligent about caring for their patients and continuing to place consults and checking up on those patients and until they got the care they needed.
Great. So what were our recommendations?
So we had one recommendation to the facility director to review the community care consult management process and appointment scheduling processes to help identify any deficiencies and then take action as warranted.
And their response?
So it was very positive. The VISN and the facility director concurred with the recommendation and already reported that ongoing monitoring and auditing of the consults had been initiated even before the report was published. So again, that doesn't mean that our recommendation was closed. We'll continue to monitor their audits and ensure that that everything looks good before we close out that recommendation.
Definitely some positive movement in the right direction on behalf of the facility.
Yes, exactly. Yeah, they did what they were supposed to do. Facility staff reported it. The director took the information and investigated, and were able to take action to correct it.
Great. Trina, as always, we appreciate you going through these somewhat complex reports with us. Do you have anything else you would add?
I just hope everyone will take time to read the report.
Well, thanks, Trina, and we will get together soon on another Hotline podcast. Thank you. As mentioned in this podcast, you can submit a complaint to the VAOIG by phone, 1-800-488-8244, or you can go to our website, www.vaoig.gov/hotline, and fill out a hotline complaint there. However, if you are a veteran in crisis or someone who is concerned about one, please call the Veterans Crisis Line. Dial 988 and then press 1. Now, let's go to Lauren for the highlights of our oversight work for this past month.
Thanks, Fred. 11 OIG investigations had updates in May. This includes a multi-agency investigation resulting in charges alleging that 2 laboratories engaged in a kickback scheme involving marketers and physicians that resulted in approximately $300 million in losses to the government. Of this amount, the loss to VA is approximately $165,000. The laboratories, through marketers, paid hundreds of thousands of dollars to doctors for advisory services that were never performed in return for laboratory test referrals. The owner of one laboratory was sentenced in the Northern District of Texas to 30 months in prison, 2 years of supervised release, approximately $180,000 in restitution, and a fine of $10,000. A doctor was sentenced to 18 months in prison, 2 years of supervised release, $143,000 in restitution, and a fine of $40,000. A VA OIG investigation found that a veteran lied to VA about being unable to use both his feet, which resulted in his receipt of VA disability compensation benefits for almost 2 decades, and vehicle adaptation benefits to which he was not entitled. The veteran was sentenced in the District of New Hampshire to 18 months in prison, 36 months of supervised release, and $662,000 in restitution after pleading guilty to making false statements. The VA OIG published 13 reports in May. 2 reports concerned the awarding of monetary incentives to VA senior executives. In September 2023, VA announced it had erroneously awarded millions of dollars in critical skill incentive payments to senior executives in the VA Central Office, also known as VACO. VA canceled the payments, notified Congress, and requested that the OIG review the matter. Critical skill incentives were authorized by the PACT Act. The OIG found VA's award of $10.8 million in incentives to 182 VACO senior executives lacked adequate justification and was inconsistent with the PACT Act and VA policy. This was due in part to breakdowns in VA leadership and controls, as well as missed opportunities to intervene at multiple levels. VA concurred with the OIG's 2 findings and 8 recommendations and provided acceptable action plans. The OIG will monitor VA's progress until sufficient documentation has been received to close the recommendations as implemented. Then, additional analysis of the improper critical skill incentive awards raised concerns that the Undersecretary for Health may have recommended incentives for at least 10 VACO senior executives who directly reported to him, and for whom he was therefore not authorized to act as the approving official. Because there were inconsistencies in available data on direct reports, the OIG released a supplemental memorandum to summarize information conveyed to the VA Secretary to further assess whether additional actions are warranted. The OIG also asked that the VA provide information on whether any other approving officials exceeded their authority in recommending or approving critical skill incentives to VACO senior executives, and factor the results into its action plans for implementing the related OIG report recommendations. Other OIG reports published in May include 3 comprehensive Healthcare Inspection Program, or CHIP, reports, as well as several reports about VA information technology and benefits. To learn more about the reports the OIG published in May, as well as updates on criminal investigations, see the monthly highlights under the Reports tab on our website, www.vaoig.gov.
This has been an official podcast of the VA Office of Inspector General. Veteran Oversight Now is produced by the Office of Communications and Public Affairs and is available at va.gov/OIG. Tune in monthly to hear how the VA OIG serves veterans, their families, and caregivers through meaningful independent oversight. Check out the website for more on the VA OIG oversight mission, read current reports, and keep up to date on the latest criminal investigations. Report potential crimes related to VA, waste or mismanagement, potential violations of laws, rules or regulations, or risks to patients, employees, or property to the OIG online or call the hotline at 1-800-488-8244. If you are a veteran in crisis or concerned about one, call the Veterans Crisis Line at 1-800-273-8255. Press 1 and speak with a qualified responder now.